Okay, this video is Harvard textbook scandal. And we start out with the question, has Harvard become a joke? And the answer is yes. The Harvard medical system has become a joke. And it's for a couple of reasons. One, because the whole thinking is based on atheistic Darwinism, which is evil and devalues the patient. Number two, more importantly, the whole thinking system is based on selling drugs. These books are really not much more than drug dealing manuals. Okay, so here's the textbook Pathophysiology of Heart Disease. You will not find Dr. Esselstyn in there. You will not find Dr. Ornish in there. They've done the best research on preventing coronary artery disease. You won't find anything about Walter Kempner, who reversed heart disease in tons of patients, as well as John McDougall or Nathan Pritikin. Okay, or nothing about the newer docs are kind of new, like Dr. Montgomery and Dr. Osfeld. But what I'm trying to say is, there's nothing about the pioneers of understanding atherosclerosis. You'll find nothing in there about William Roberts. You'll find nothing in there. I don't recall seeing anything about William Roberts. Not that I'm aware of. There might have been something in there, but I don't know. I didn't see anything about Dr. Sloop. They're going to tell you that 90% of hypertension is essential, idiopathic, unknown cause, which is absolutely ridiculous. Without epidemiology, nutrition, and toxicology, you can't make sense out of disease. So it's ridiculous to call these books pathophysiology. That means understanding of disease without those things, and they don't include those topics. So these books just become sort of a nonsense factory to diagnose disease with mechanical methods, lab tests, and then to prescribe drugs. Okay, and maybe throw in a stent or surgery. But look, Esselstyn cured, 100% of his patients who followed his diet were cured. Why would you want to mess around with all these drugs? Just stupid. Okay, here is the renal pathophysiology book by the Harvard authors. And this one too, I've read about 2/3 of it now. There's next to nothing on nutrition. There's like half, or the equivalent of a quarter of a big book, a half a page of really Mickey Mouse introductory level stuff. Okay? And that's the most important thing to know about kidney disease. What causes hypertension? What causes diabetes? What causes obesity? What causes autoimmune disease? But that's not going to be given you in the book. There'll be all this technical gibberish in detail, but they won't tell you how to prevent kidney stones and all this other stuff. Okay, not in adequate detail, not from a strong, sophisticated nutritional point of view. Okay, here's the internal medicine textbook of Harvard. And again, it's the same big joke. Without talking about nutrition, epidemiology, toxicology, you really can't have an intelligent, sophisticated conversation about disease. I know doctors from several different universities, and I'm not aware of any of them that I can have a real sophisticated conversation, because none of them, and I mean even the best AOA, top-of-the-line ones, knows nutrition, epidemiology, and toxicology, and that's what I would consider the introductory subjects to understanding disease, okay? So these books are a joke. Internal medicine docs, they mean well, but they're ignoramuses. Without knowing nutrition, epidemiology, toxicology, then you don't know what causes obesity, hypertension, and diabetes, and atherosclerosis, and a lot of these other diseases, abdominal pressure syndrome, dementia. It all comes from understanding that. So you don't have the foundation. It's like being a basketball player but not knowing, how to dribble or free throws. Okay, how could you be a real basketball player if you don't know what you're doing? Okay, and these other books, they're also a joke. Here's a neurology textbook, and you'll find 2 paragraphs on excitotoxicity. There should be 100 pages. That should be the center topic of the whole book. A bunch of nonsense about Alzheimer's and other stupid stuff. It's a big joke, okay? Here's a pathology book, and again, same thing. They're not going to tell you what causes disease. It calls itself the pathologic basis of disease, but it doesn't tell you what causes disease. You should be told, this is what causes obesity. This is what causes hypertension. This is what causes coronary artery disease. This is what causes abdominal pressure syndrome. This is what causes dementia. This is what causes autoimmune disease. That would be a real book. This is what causes cancer. This is the metabolic theory of cancer. None of that stuff. This entire textbook system, what I'm trying to say is Harvard is like the head of the mafia drug dealers to keep all the doctors as being a bunch of ignoramuses. It's ridiculous. Now, this book is one I did not read. I've gone through those other books quite a bit, but this one I only looked at it a little bit on the, the for sale things. And the only reason why I'm showing it is just because Harvard is notorious for being one of the biggest drug pushers in psychiatry. They were major proponents putting attention deficit kids on these amphetamines, okay, which is insane. And there's also been other psychiatrists from Harvard who I've heard speak like, BRE, GG, then IN, greatest psychiatrists who ever lived. And they are big drug pushers. And all psychiatry drugs are bad for the brain. They're all bad for the brain. They all cause a slow lobotomy. The antipsychotics can cause a relatively rapid lobotomy. It's a big joke. And then in the best hospital rankings, they ranked, MGH was ranked #1 in psychiatry. What a joke, okay? Rheumatology is ranked way up there. What are they going to do? They're going to prescribe a bunch of drugs. I've never heard of a conventional medical doctor talking about dietary causes of autoimmune disease, but that's the most important causes. We've talked about them before. Why wouldn't you want to fix leaky gut and everything else related to it and the related toxicology? So anyways, I'm just letting you know, it's a big joke. It really is. And then with atheistic Darwinism as their moral system, what that means is they don't respect individuals. They don't consider people even human. They consider them talking monkeys with no intrinsic rights, with no God, with no afterlife, with no soul. Okay? You think that's quality medicine? Harvard's become a joke. You stepped away from your religious foundation and you've sold out for money and you no longer care about people. And sadly, it's a joke.